Hi everyone, our first topic is Introduction to Exercise Therapy. At the end of this topic, participants should be able to, number 1, define terminologies such as exercise therapy, strength, endurance, and etc. Number 2, describe the goals of performing therapeutic exercise. Exercise therapy is a means of accelerating the patient's recovery from injuries and diseases which have altered their normal way of living. Injuries and disease can cause disabilities. For example, after an accident, the patient's functional activity daily living altered from independent walking to dependent walking. Exercise therapy knowledge will help the patients or carer to optimize the patient's function and able to reduce the secondary complications due to the total bed rest. There are many goals of practicing therapeutic exercise. Generally, it helps to prevent the dysfunction. Specifically, it helps to develop, improve, restore, or maintain of normal strength, endurance, cardiovascular fitness, mobility, and flexibility, relaxation, coordination, and skill. Let's have a look at the first goal of this therapeutic exercise, which is to develop strength. What is strength? Strength is the ability of a muscle or muscle group to produce tension and a resulting force in one maximal effort, either dynamically or statically, in relation to the demands placed upon it. The normal strength can be defined as adequate, typical, or average strength of a single muscle of a person or of a general population group. For example, you and me don't have any injury or disease, so our muscle strength is considered as normal if the strength is adequate to perform our daily functional activity. The next goal of therapeutic exercises is to enhance endurance. Endurance can be defined as work performed over a prolonged period of time. Endurance is necessary for performing repeated tasks in daily living and carrying on a sustained level of functional activity. For example, able to sustain walking and climbing stairs for a prolonged period of time without feeling tired or exhausted. Next, we proceed to mobility and flexibility. Mobility of soft tissues and joints is necessary for the performance of normal functional movements. Soft tissue and joint continually elongate and or shorten so that appropriate length is maintained. If normal motion of body parts is restricted due to injuries or disease, adaptive shortening of soft tissues and joint will occur. This will affect our daily living activities such as disturbance in normal walking pattern, limitation to move the limbs and joint, and so on. So, normal mobility and flexibility can be maintained by performing some of the techniques in therapeutic exercises. One of the goals of therapeutic exercise is to improve relaxation. Relaxation refers to a conscious effort to relieve tension in muscles. Through the therapeutic exercise, an individual can become aware of prolonged muscle tension and can be taught to control or inhibit it. The last goal is coordination and skills. Coordination refers to using the right muscles at the right time with correct intensity. Here are some definitions of muscle performance that you might come across through the literature. Force is an output of a muscle which develops tension in the contracting muscle so that it contracts to produce work. Work is defined as the action of a force over a specific distance in space. In human body, work refers to the product of muscular force exerted through a specific range of movement. Power is known as a rate of doing work. In muscle action, power means the output of the muscle at specific speeds of contraction. Endurance is the capacity to contract muscle at a specific rate for a specific interval time. To understand more about minor skills, handling techniques, and etc. in this course, please browse through our next lecture. Enjoy watching.